All right, we are good to go, Mary.
Okay, and I believe I need to remind everyone about being recorded and being live streamed also. So welcome to our November meeting. We have most folks here right now. And Suli is joining us too. Good. All right. So in addition to the agenda is that we'll have a brief executive session at the end of the meeting to discuss a nomination. So that's the only change that I'm suggesting, unless there's something else that is on folks' minds to add. Okay. So we don't have any guests today, but any questions or comments from board members? Larry?
I just want to announce that the mental health conference is coming up on December 19th, which is Friday. It will be via Zoom, and several agencies are involved as usual, including FLIC, the mental health department, Family and Children's Service, Suicide Prevention and Crisis Service, and other departments. I'll have Karan put out the publicity once I've forwarded it to her. The topic this year is children and youth mental health, particularly as it affects families and takes place, the struggles that children and youth are dealing with is taking place within the context of a family. So look for that. And Harmony is our keynote speaker, but we're also having a panel that will be facilitated by young people and include young people as they're speaking about their experience. And we'll have a community cafe that looks at the issues related to families and children. So I think it's going to be a very interesting and exciting conference. Again, publicity will be coming to people as soon as possible.
When is it, Laurie? I missed that.
August 19th. November 19th.
Okay, thank you.
It's all day on Zoom, and of course you can pick which pieces you'd like to attend, and there'll be publicity about that coming out as well.
Okay.
Okay, thank you. Great. Anything else anyone wants to mention? All right.
I had a question, and it had to do with last month's meetings, the material. Should I wait for that or do it now?
I think that would be fine to go ahead, Jan. Sure.
Okay, so in reading over the minutes, I noticed that it said the mental health subcommittee has 11 members while the other subcommittees have 9. So I was a little puzzled about, does that apply to us, or is that just some places? And then it also said there should be 3 community services board members on each group or subcommittee, 2 consumers and 2 parent or relative. And I was a little concerned about the 2 consumer things if we need to start paying more attention to that.
And I think that was what was presented from the JED who attended the meeting. And I know Kaki has had some additional contact with him for clarification about some things. So maybe during the bylaw discussion, we could, unless we think it's a typo or something that wasn't said, maybe that's something that we can clarify.
Okay, that sounds fine.
Keki, are you? I think you're on mute there.
Gonna say, I didn't discuss that particular issue with him, but I think we should clarify it. So in fact, I'll add it to my little list of what I did clarify with him was his statement that, well, first of all, we have 9 members on mental health, right?
Yes.
Yeah,
And all
same.
subcommittees. Mhm.
yeah, the statute allowed it to be 11 members if that was the local choice. But we've always chosen 9, so that's what we are. The issue about how many CSB members are on subcommittees, I did clarify with him, and he acknowledged that his slides were wrong and that he was giving the wrong advice when he looked back at the statute. And his position is now that it's exactly 3 CSB members on each subcommittee, not more, not less, which means y'all on mental health are going to have to figure out who's on.
Okay, so we'll go into more about what you learned, Kaki, and further discussion about the bylaws a little later in the agenda. But this sounds like a good time for us to look at the minutes and make a motion about accepting them. So any motion on that?
I'll make a motion to accept the minutes as presented.
Second.
Okay, any further discussion? Okay, so all in favor of accepting the October minutes?
Aye.
That looks unanimous. Thank you. Great. Okay, thanks for bringing that up, Jan. I think there's still stuff for us to be figuring out about this all. Yeah. Okay, I don't have anything for the chair's report, so we can move on to subcommittee reports. It's been a couple of months since we've had reports from the subcommittees. And as I look at the gallery here, I'm not seeing someone from substance subcommittee. Is that correct? So I expect Stu to attend. I'm not sure about Tom.
I don't think there's anyone from ID. Oh, is there anyone here from IDDD?
I think Elise,
Me, but I don't really, not prepared to give any kind of an update.
okay. I think Elise will be attending shortly. So maybe we can hold off on that. And Larry, you've got
I've got all of their time. Oh, I could go on for 30 minutes if you want me to. But actually, I was going to say, the thing that I was going to update people on is later in the agenda. So
yeah, would you want to just do that at this point since we
sure,
have the
sure. And with Harmony's assistance. So our subcommittee, like I assume the other subcommittees are, by Harmony's real insistence and drawing attention, really working on the goals and objectives that we identified. Imagine that. We don't just every month make up an agenda. We actually follow along with things we said we were going to do. So 2 things that we're doing or will be happening or are happening now are this thing called sequential intercept mapping and system of care. Is that what it's called in the for children and youth? So the sequential mapping rises out of this other training that we did. What's the police training that is happening or has happened?
The crisis intervention team training.
Yeah, the
Yeah.
crisis intervention training that we're doing, that most of the police agencies in Tompkins County have engaged in and have sent representatives to people in the know about this. including Harmony and other colleagues, have put together or made arrangements to have funding for this training that trains, gives police officers more training about how to interact with people with psychiatric and other kinds of disabilities. So mostly psychiatric, but other kinds as well. Including what I hear is a really great ending portion, which is people telling their personal stories about interactions with the mental health system and with police as it relates to the mental health system. So related to that training, we're rising out of the understanding that we have a lot of work to do around policing and mental health. We are in the process of doing sequential intercept mapping, which is a very deliberate, and Harmony can send you more information, but it's a very deliberate look at each piece of the interaction that happens between officers, social workers, the person in distress, the families, and ask questions about how we're doing as we go along in each of these intercept points. I hope I'm describing this well. So that mapping is happening, and Jean Poland, who is a member of the subcommittee, and Harmony and other people from the department, right, are involved with other people throughout the community and sort of looking at these kinds of scenarios as and thinking about where are the gaps. So that's related to a lot of work that we're doing around what the crisis services, what we want them to look like. In addition to doing the officer training and the sequential intercept mapping, we've talked with the county with, oh, I'm forgetting her name, which Deanna Carruthers, the diversity manager, the major diversity officer for the county, talking with her about reimagining public safety. Additionally, we've been meeting often with, it seems like, Sally Manning, who is the SPOA coordinator for kids through RACR. And this month, we had the fabulous Jaden McCune, who all of us who know her are sad that she's retiring, who really started what I think most of you know of, now I'm forgetting it, the Collaborative Solutions Network, which has really tried over the years and very successfly to develop the services and to develop supports for kids in the community. So Sally and Jaden and other people have really been helping the mental health subcommittee with our expertise. It's not like we don't know nothing about anything. We really, I think, are making very good progress, at least in terms of identifying the kinds of things we should be doing to accomplish the goals and objectives related to the two major goals that the mental health subcommittee identified, which are improving and developing the crisis services in this community and developing services for children. One of the big issues for us is that we have access to a bunch of medicatable services that are supposed to be available for children with very specific and high levels of need. But part of the problem, and this is related to the discussion among the the goal related to frontline workers that the Developmental Disabilities Subcommittee identified, which is there are no people in the community to provide the kinds of services that if we had people in this community would be able to do, or if the funding was, I think more correctly, I should say, it's not like we don't have the talented people. It's that the money, the resources that are available to support the work that those people are doing is completely inadequate. So I think that's a lot of what we've been working on, and of course, and you'll be hearing about this later. The mental health subcommittee has been along with the developmental disability subcommittee, particularly Elise, has been working on the peer support, what the peer support services look like, and what the peer support community, particularly communities of the community of people who are certified peer specialists, what kind of work they're doing. I don't think we're doing much more than that. Harmony, is there anything you would like to add in terms of, I mean, I think I got most of it right, but I might not have used the words in the right order. Oh, here's another thing we're looking out for. If there is anybody on the board who would like to volunteer to be part of the system of care discussion, which is trying to develop a system of care for children, you don't have to be a member of our subcommittee to volunteer to be part of that. I'm looking at certain people. I'm also looking at members of my subcommittee and trying to exert my mental pressure. Okay, so is there anything like more technically accurate that you want to add?
Well, the CIT training was completed. The crisis intervention team training was completed. And one of the nice things about getting the grant is it will allow for funding, and the sequential intercept map was, that work was done. It was a day-long work, and I still haven't received the analysis of it. So, but once I have that, certainly we'll share that with you. And then the nice thing about the grant is there's funding to train the trainers. And there were people identified, both a mental health person, the lady who works in the jail providing mental health services, and someone from the sheriff's department will be getting that train the trainer, and they will co-train in the future. So we'll be able to continue to train people in that model once they receive the training next year. And then the system of care process, it's really going to be a couple of hours worth of training, like every week. Like I think it's like 2 hours every week for a month. And then there's this culmination where you develop a strategic plan around how you want to meet the gaps for services in your community, which really aligns well with our local services plan around finding the gaps in children's services. And then what do you want to do about it? There was a grant that just came out recently about that can be tied to, we volunteered to do the services of the system of care strategic planning process already. But then OMH just released a potential grant that we're going to look at. It's not a big grant. I think it's about $25,000. But if you do the system of care, it helps you create some sort of, seed money to do some things around the system of care for children, whether it's fixing up your website to advertise those services, maybe hiring a part-time coordinator or something like that, whatever kind of thing. So we're going to work on that a little bit too. And the hope is to have representatives from the subcommittee and the Community Services Board participate in that process, so you can bring that information back to the other members of the board, since that was one of our big goals that we had highlighted. I think that's it, though. Larry, you got most of it.
Yeah. So I would love to do this because I have lots to say about what I think should be in place for young people. but it's not my area of expertise. So if anybody feels like, especially somebody new who wants to get their feet wet on a thing that the mental health subcommittee or the community services board sometimes does, this would be a great time. Not that I'm staring at anybody in particular.
Should folks reach out to you, Harmony, if they're interested? And
Yes.
great.
So, she said essentially what I said and said it better, but I'm pretty good at this stuff. So that's me, that's us. I'm really happy with the level of work that the subcommittee is doing. We've just been, I think, firing on all cylinders, or some such car analogy.
Any questions for Larry? Anything? Great. Thanks for that, Larry. All right. Since I expect Elise, I wonder, Harmony, would you be able to tell us what's happening with Substance? I'm not sure if anyone will be attending from that group.
So the
Elise is
substance,
trying to get in now, so I'm gonna let her in. Okay.
Okay. Thanks.
so you want me to go ahead with substance use subcommittee?
Yeah.
So they've been really focusing heavily on workforce recruitment challenges that are being experienced across all of the mental hygiene sectors and, the public at large. And it's really challenging because the workforce challenge problems are felt at direct service positions to medical staff to clinical counseling staff, at every level of the system, people are experiencing challenges in hiring. So there's been some work on what are the things that got people in this field in the first place. They've done some brainstorming activities. They're working to try and identify what are the ways that we can encourage people to join the field. And then what are some barriers to it, and what are some potentially creative solutions to support workers? And one of the ideas that has been floated is around housing. Like, we know housing is very expensive for people, and because of that, other counties around us might not have the same challenges we do because the housing's so expensive here. So people may live out of the county and drive in, and that creates transportation costs for them and makes it difficult for people to hire here. So are there ways to reduce the cost of housing specifically for people who maybe work in the nonprofit sector or who are working in the human service sector at large? So that's been an area of focus that they've had some special guests talk about. It's a big issue. And I think at some point they'll probably be doing some work with developmental disabilities around that, because that's another group that's really looking at that particular topic. So that's been their focus, is really around what are some creative solutions that we can come up with and help support in the community around the workforce crisis.
Okay. Any questions? All right. Larry, did you have a?
So just to say, maybe at some point it would be useful to have the chairs of the three subcommittees sit down and sort of, since we all grapple with this, maybe we could sit down and brainstorm a way to start a broader community discussion on this topic, because I'm sure we're not the only human servicey type people who are trying to make this a go of this.
Hi,
Maybe-
everybody. It's Elise. I'm so sorry that I had trouble getting in. Larry, to your point, I think that might be a good idea. I think we've had a little bit of trouble engaging the folks who attend DD Sub in the topic. I mean, I would love to see like some type of roundtable event where, you know, this topic is discussed. And it's been so like Liz Smith, for example, who's the executive director of Unity House, shared that they don't really feel like there's much that they can do to impact this problem right now. A lot of it has to trickle down from policy. And so I just feel like some idea sharing, some idea generating around this crisis would be helpful.
Yeah, that's a great idea.
I mean, it even occurs to me that even if we don't solve the issue at a systemic level, maybe there's a way to convince our electeds, you know, at the state level that Tompkins County really needs the money, right? I mean, we can advocate both for the system and get connected to the larger work going on, but we can also talk to our elected people and say, hey, you need to help us figure this out because, you know, we're Tompkins County and we're annoyed.
Okay. So we should take some steps to follow up with pulling people together. Sounds like that would be productive.
Yeah, and just to mention, this is November is Home Health Aid Recognition Month. So there's several things that you'll probably see on the listserv that are related to that. One is, I believe, a panel discussion about it. And what's interesting is that the agencies, the home health agencies, have so much trouble recruiting that for those positions that one of them even dropped CNAs as one of the things they provide. And yet for consumer directed personal assistance, even though it doesn't pay better, we have over 200 people in our FI system for that. So that kind of interests me in terms of, you know, I don't want to go on too long here, but in terms of what is different about that makes people more attracted to those positions than they seem to be attracted to even the certified nurse, or what is it, certified health aide or whatever it is, that pays better, and yet they're more interested in being in this program. So that's just an aside.
But that's
Maybe because it's personal.
Yeah,
You know, I mean, they know the pace they're working. It's not a, gee, is this what I'm going to do? It's this person needs my help and I want to help them.
I think that's part of it. I think it's one of those things that probably has different reason, you know, more than one reason why people are attracted to it, but I think that's definitely one of them, Kathy.
And not the agency bureaucracy.
Maybe, yeah. Yeah, I think people do like the fact that I don't think they see it as simple because, you know, we get so many questions and so many, why do I have to do this? And why do I have to, you know, go get another physical or whatever it is. But I think they do like the flexibility that is allowed in that type of program instead of being told this is who you're assigned to. So again, that's kind of a personal thing, but it's also not just the person that they're helping, but the fact that they can choose, at times, choose their own schedule. But anyways, I don't want to distract us too much. I just suggest that people maybe check out some of the things that are going on this month in recognition of this month, the home health.
good. Thank you. Good. Elise, would you be able to give an update on the DD subcommittee? Your connection was a little difficult earlier. I don't know how
Yeah.
that's.
it may still be difficult. I'm sorry, I'm in a parking lot in Baldwinsville. So I'm not sure how my signal is here. Yeah, if you help be my memory as usual, somehow this update always catches me off guard, even though I know I always have to give it. I will say that I have felt the past couple of meetings have been very productive in terms of dialogue. So I felt for a while, especially because agencies were so overwhelmed by COVID, that there has been sort of just a perfunctory update and not as much engagement. But I feel like people are starting to maybe things are stabilizing a little bit on the agency front. And so there's been a little bit more willingness to engage. Last meeting, we had a great presentation from Jan and Jeff Bowles at Flick on I'm going to get the name of the exact program wrong, Jan, but it's basically your emergency planning task force.
Yeah, it's a
And-
CAG. It's Core Advisory Group is what it's tagged as.
Thank you. And the work that they're doing around that at Flick. We had we have not had, so one of the challenges has been, I think again last month, if I'm not mistaken, Sheila, we did not have representation from the DDRO. So we have had very sporadic representation from the DDRO over the last many months. And when they have come, they have not recently been able to share with us numbers around, for example, referrals through the front door, the OPWDD front door, et cetera, which used to be pretty standard information that would be shared by the DDRO personnel. So that's been a little challenging. I think they are also overwhelmed. And I think they are also probably, like most state agencies right now, struggling with a slew of retirements. So hopefully that will get better in the future. I did, request that they make more of an effort to have representation and then hopefully share numbers at the county level. I'm trying to think what else. Anything else I'm missing, Sheila? Oh, the one thing that was brought up by Barbara Logan, she is a non-member but has unofficially represented BOCES on the committee for a while, and Barbara will not be attending anymore in the future, and so we're hoping to get other representation from the BOCES and the school district as well. The person who replaced Sheila as the director of special education, Jen Gondek, has not been attending on a regular basis. So we're hoping to get some type of special education representation from the ICSD.
Okay. Any
And
questions? Go ahead, Khaki.
I'm not muted. I'll be Sheila and say that's right, Lise.
Yeah, Sheila's not here today, Elise.
Oh, sorry, because I'm on my phone. I don't have my all my thumbnails. Thank you, Khaki.
All right. Okay, well, thank you, everyone.
Elise, can you say what meeting that was that didn't have representation from the school district? That, well, not representation, but where Jennifer Gondek wasn't, showing up.
Sure. So it's the Developmental Disabilities Subcommittee of this board. And in the past, when Sheila McHenry was the director of special education, Sheila attended every month. And when Jen took over, she was told about the meeting. She's been invited to attend, but she's only attended a couple of times and then has not attended recently. So it's probably something that feels like, I can imagine how it might feel like a low priority, but it's really nice to have that connection and that dialogue open between the providers of adult services in the community and the school district, if possible.
For sure. Thank you.
Okay, great. All right, well, why don't we move on to Harmony's report and see what else you have to share, Harmony.
So just a few updates. I wanted to let you know that I'm working on the contracts right now to get them updated for the 2022 year. We're going to be using what's called a results-based accountability model. So the outcome measures and the contracts will be updated a little bit. So how much, how well, and how better off are the people that you serve. Kind of simple measures that are going to be standardized as best as possible across all the agencies. So if you want to see me now, it's going to be tough because I'm back-to-back meetings on contracts right now for the next few weeks. Earlier in October, I attended Attorney General Letitia James when she came to town, and that was held at Alcohol and Drug Council's facility up in Lansing. It was kind of a hush-hush meeting, and it happened to be on the day we were supposed to have the substance use subcommittee. So we had to actually cancel because so many people were attending that meeting, but couldn't publicly say that's where they were going, for security reasons. They didn't want it announced publicly ahead of time. But that was really just a wonderful event to see the dollars that are coming from her Heal New York tour, from the litigation against the pharmaceutical companies and others that sort of fanned the flames of substance use in communities and the opioid addictions. And there's dollars that will be coming to our county as a result. The check was $1,756,993.59. Of course, that's going to be over a period of years, but it's still great to know that that money will be spent to address the needs for substance use treatment and prevention services in our community. The mental health department, I thought I'd give you a little bit of update on what they are doing. As you know, I think everyone is pretty exhausted after addressing COVID. Nobody has been unaffected by it. So one of the things we really wanted to focus on was self-care for the employees. So October 14th was a day that we spent the entire day on trainings that people could select from on the concept of self-care. And there were a lot of wonderful strategies that were provided to people that are actually very simple, doable things you can do in the office. How to debrief a situation, right? Like if you worked in the field, you might have a really sort of tragic thing that happens and you really sort of need to process that maybe with another therapist down the hall. But you don't want to go in there and maybe re-traumatize them, right? If you're sort of dealing with that, how do you have a conversation and get to be able to talk about situations, but just give enough detail to do that without creating more trauma in the workplace? So some simple techniques that people can use in their day-to-day work. On top of that, we've looked at creating more flexible scheduling for people, using a 4-day work week for people who are interested in that. And also having more flexibility built in their schedule so people can pick, they know what they have, their productivity needs to be, how many people they need to see, that sort of thing, but having more flexibility in how they arrange their schedule and having some times that are carved out where people can do things together. I think one of the things, a lot of people like the, working from home and doing the telehealth, and that certainly has many benefits for people, but there's something very powerful about being able to get together with your coworkers as well. And so creating time where people may be able to do some of these self-care things together. Maybe it's just going for a walk at lunch, that sort of thing. We're trying to really be aware of what the needs are of our mental health workers so that they can be strong and resilient during this challenging time. So those are some of the big things that have been going on. Any questions?
How is the staffing for the clinic, Harmony, at this time?
So I would say, we're facing some of the challenges other places are facing as well. We do have some vacancies for social work positions, and there's a civil service exam being given as well. So some people are going to be taking that exam. Some people who applied will be taking that exam. So we're kind of in a state where you have to wait a bit for people to get through the civil service process with exams. So we do have some vacancies there we're trying to fill. We just hired someone who started today who will be working in our children's program. And that vacancy was created by a promotion for somebody. So, but there are a couple of other social workers that we need on staff. We also have a psychiatric nurse practitioner vacancy. And as I'm sure all of you are aware, anybody providing medical services, there's a pretty big shortage out there. So we're hoping to fill that as well.
Okay. All right. Thanks for the update. Moving on to the bylaw discussion. Kaki, would you be able to take that?
Sure. And I went back and looked at the statute while we were talking about other things. So let's start with who's on the subcommittees. And as I noted, Jed has agreed that his slides were wrong, and that it's 3 board members on each subcommittee, and exactly that. Now, the question about 9 members or 11 members is that the statute says at least 9 and up to 11 on mental health subcommittee. So at 9, we're still fine. We're not out of compliance kind of thing. There is actually in the statute right now language that requires that there be on the mental health subcommittee 2 members who are or were consumers, and at least 2 members who are parents or relatives of persons with mental illness. So I don't know, I didn't pay much attention to that because I didn't know who was on our subcommittees, and I just sort of thought people were paying attention to that. But from the earlier conversation, I'm assuming we don't necessarily meet that criteria. Is that so, Larry? Okay. So that's probably something we should be keeping in mind as we approve new members for that committee. Until March 31st, 2024, because the law changes on March 31st, 2024. And at that point, it's absolutely 9 on each subcommittee. And there no longer is the requirement of these 2 consumers and family members on the mental health subcommittee. So between now and 2024, that's when we need to deal with that. Larry?
I don't know who, if anyone officially, we haven't polled members of the subcommittee. We could. I know, I mean, I identify as a recipient. I know that the person we're talking about this evening in I assume an executive session is a family member.
Mm-hmm.
I think other people are either family members. I don't think there's somebody who, other than me, who specifically identifies as a consumer of services.
Well, we should probably come up with a way to poll the members of all 3 committees, and do it in a way that doesn't make them feel uncomfortable or whatever. And maybe it somehow comes from Frank. I mean, so there just that information goes to Frank just so that we know we're in compliance. Because what the statute says, and this language does not change in the new statute, is each separate subcommittee shall be composed of persons who've demonstrated an interest in the field of services for a particular class of mentally disabled, and shall include former patients, parents, or relatives of such persons, and community agencies serving the particular class of the mentally disabled. So we still need to have, there's no number requirement, but we still need to have people who identify in that way on all 3 of the subcommittees. So we should just give a little thought. We don't have to do it in a meeting, but how might we do that without saying, raise your hand at a meeting, just in case somebody was uncomfortable with that.
Yeah, I'll have to talk with the clerk of the legislature as well, because technically these are appointments of the legislature.
Right.
And they probably should be collecting data on compliance with this rule, which probably would mean changing the application and or some way of capturing that information so that the review committee would be able to know. Because as
Yeah.
soon as we ask that, that's confidential information that would have
That's
to be
right.
protected as such.
That's right. So it would have to be collected in some way that it wasn't. And I don't think that language is in the charter. I hadn't printed off that page of the charter. I don't know that the charter speaks specifically to the subcommittees, but it is definitely in the statute. But as I say, changing on March 31st, 2024. I love passing laws that aren't going to go into effect until, in this case, it was 5 years later. I'm not quite sure I see the point of that. But so that's something for us to look at. Definitely now and in the future legislation, as I said, it's 3 CSB members on each one of the subcommittees. We still have the question of whether we want to recommend term limits, which, as Jed noted, the charter doesn't require. The statute does, but allows the local government to not make term limits. So the current charter doesn't. If that's something that we want to have be part of it, then it's going to be part of our recommendations to the legislature as they make the charter revisions. I'm going to suggest that with that, and maybe a couple of these other areas where it was like, do we want to make this change? Do we not want to? That the ad hoc committee come back together and take the things that we've learned and maybe come back with some proposed language, and maybe in some of those cases, alternative language. So that what might the language be if there were term limits, what might it be if there wasn't term limits, kind of thing. The other piece I got out of him is we probably need some language in here, as well as should probably be in the charter, that talks about how someone is removed, and making it clear that there need to be written, not our bylaws right now. The only reason to remove someone has to do with the missing 3 or more meetings. And then it talks about just making that recommendation based on that. But from Jed, obviously we need some language in there that requires some kind of written description of why that recommendation is being made and providing some kind of due process. And obviously the legislature would have to do that as well, but we probably ought to just clarify that. Were there other thoughts that, because I'm sure everybody's given a tremendous amount of thought about this since we last talked in, what would have been July? No, September.
September, yeah.
September. Or other issues, but as I say, as I looked back through it all today, my gut is that it makes sense to do some writing and come back to the full group with some options perhaps in those areas where also want to look at the language in the charter, in the statute, and in the bylaws in terms of what we may want to have in terms of purpose of subcommittees, or what their roles are. There's also, be interested to know, other language that's going to be omitted on March 31st, 2024, is that mental health has some specific authorization, shall be, that they're authorized. You don't have to do this, Larry, because I don't think you've been doing it anyway. To annually evaluate the local services plan and authorize to report on the consistency of such plan with the needs of persons with serious mental illness, including children and adolescents with serious emotional disturbances. Any such report shall be forwarded annually to the Community Services Board, Director of Community Services, and a copy sent to the Commissioner. So you're authorized to do that, but it's not requiring that you do that. And it's going to disappear in a few years.
I don't think we call it that, but I think the planning process that happens when we put together the state the plan that goes to the state
Yeah.
often does that, because what we're doing when we put the plan together, and this is true of other subcommittees, is identifying the gaps that we think
Yeah.
are missing.
Mhm.
Yeah.
That's
But
true.
you're not producing a written report, and that's what they're
No,
talking to, that you send to the commissioner and give you some other work to do. But as I say, that's going to disappear anyway, unless they again decide to change the law many years in advance. So
Okay.
I guess that's sort of all I've got. If anybody's had any other thoughts about things, Larry.
I have a small thing to add to the writing, which is just to do a scan to make sure the disability language is up to date.
That what?
That any of the disability language is
Right, as well as gender
comfortable
specific
with, and
language,
it's
right?
and is empowering, and
Yeah,
like, we should probably somewhere mention that we're really in the business of helping people to recover and to live independently and well, and stuff like that.
yeah, I was reading the statute, which is not very PC.
Yeah, it's pretty gross, I must say.
Yeah.
All right. So the bylaws group will convene and we'll get back to the larger board then at a,
So where do we sit? Is the legislature, Frank, beginning to have any conversations about the charter?
Not
Should
yet.
we? Okay, I'm wondering is Christina still the chair of Board of Health?
Yes.
I'm
and they-
wondering if, that we should maybe have a conversation, at least with her, before we make our next, before we come back with language and stuff, Mary.
yeah, that's a good idea.
Yep, she's convening a small group to look at the Board of Health stuff, similar to what you all are doing.
Okay,
I think with the idea that eventually you'll come together and share ideas.
Yeah.
Okay. All right. So more to come. Thanks. All right. Let's move on to the report on the peer support meeting that we had. I think Jan and Elise are going to take a lead with this part of the meeting. I think all of you received a document late today about what the minutes that Harmony took related to that meeting. So I don't know if you've had a chance to look at that, but Elise and Jan can review it and see what kind of questions come up. And obviously Larry was part of this too. So if you want to jump in, Larry, if something isn't mentioned, feel free.
that's the email that you just sent, Harmony?
Okay, I can get started a little bit here, but anyone that Mary just mentioned, including herself, who was there, it was myself, Larry, Mary, and Elise that were on the work group that were listening to the guest speakers. And the guest speakers, I may mispronounce some of their names, but Ellen Helion, who is from the New York Association of Psychiatric and Rehabilitation Services. She talked a bit about the history of peer services in mental health. I thought it was interesting that she brought up that peers brought the recovery message to the mental health field. Other than that, it was kind of what you might expect, that deinstitutionalizations played a role in peers eventually becoming a part of recovery or of services for people. Daniela Labat, sorry if I've said that wrong or butchered her name, but she's the director of Managed Care Readiness Initiatives and a past PROS director of the New York Association of Psych Rehab. And she talked about how peer services fit into the PROS model. She talked about how they can support, peers can support teaching self-management and social skills classes. And they're an important part of the treatment team and bring a different perspective. There was also an insertion, I believe, by Elise to discuss a little bit about how peer support staff shouldn't be seen as a lower paid or part-time, because we make the decision they're part-time because they are on benefits like SSDI or Medicaid, that they should be the position should just be seen as any other position would be in that regard. I mean, obviously they'd have possibly different responsibilities, but in terms of whether it's full-time or part-time, that's a decision the individual should make when they apply and whether they apply. So so she's just brought up like not creating a second-class employee with the peer system. But that
And
also,
Dan,
yeah.
just if I could interject, I will say that the other woman from NIAPRIS, whose name is escaping me at the moment, really articulated very clearly how that can be done and done well in terms of just professionalizing that role and making sure that we're not trying to manage the problem of somebody's benefits on their behalf proactively, when perhaps that isn't even necessary, nor should we.
Right. Yes. Yeah. Definitely was a good discussion and made a lot of sense. There was also, let's see, what other names do we have? We have Tatiana Thomas of Reach Medical was on the panel, and she said they have a peer advisory board that was funded by a grant they received, and the peers receive a stipend and laptops. So that's been helpful for them to have that perspective from that advisory group. And they're also trying to figure out how peers can get the 500 hours of work experience that gets them their certification through the training. And she said there's barriers for billing for peers, especially in the Medicaid system and electronic health record. So James Beaumont from Unity House was there as well. He said that they have kind of organic peer services, sort of began during the COVID time, and that they're looking at how they can incorporate this into their future services. Josephine Gibson provided a whole PowerPoint. They have had a long history in our community of providing peer services. I believe she said that everyone that's employed there, almost everyone, is peer certified, and they offer different groups for adults and youth, and they're very experienced in that. Brad Walworth of Huga Addiction Recovery Services did an overview of their peer services in Oasis license programs, and he described their ride-along program in Binghamton with police. And the peers are a major benefit to outpatient services, and wishes they could have more peers working in residential settings as well. Then there was Tracy Decker of Lakeview, and she said that they started to incorporate peers in their services in 2015, and that there will be a full-time peer specialist at the new West End Heights, I think it's called, that's about to open right near Ithaca Bakery. And she said the big pro with them were that they, with having peers, is that they help people not have to do things alone, like go to a doctor, or go take care of some other piece of business. And then Heather Sanford from the pros director at TCMH talked about why they wanted to have peer services. And I'm not as clear on that because I'm cheating from the notes here. And somebody else can certainly insert on that. But one of the things that Mary, and I think all of us agree that were important, that were the recommendations that came out of all of this. And there were several, and one was that ensure that payment and benefits are commensurate with similar positions, ensure that pros peers have access to peer support through trainings and or consultation support, and receiving guidance from Ellen Helion. And actually, now that I'm saying that, I think that was what pros, what Heather was talking about. So those were some of the things she advised. And then the community services recommendations or reflections were that we learned a lot about the broad array of peer services. Of course, FLIC is also considered a peer service agency, but it's a little bit different because it's not just adding a position per se. So we didn't really take part in that so much, but we're part of that array of services. And work group members supported efforts to have some sort of a group where all the peers can get together, perhaps, and share ideas and provide support to each other, and just stay in contact. And was there another one, Mary or Elise, do you remember? Seems like there was one other.
Yeah, one of the things that came up, as you may recall, this all kind of started when Harmony reminded us that there was some funding available for peers in the PROS program, and we kind of stepped back and wanted to take a look at what that could look like and what the issues would be. But one of the things that came up in this discussion was, could there be potentially peer support at the hospital when folks are in crisis and end up in the emergency room? And that sounded like a really effective way to perhaps avoid some hospitalizations, perhaps connect people in ways they hadn't been connected with supports before. So when we discussed that, we were excited to think about the potential there too.
Yeah, that's right. That was a great discussion there as well.
Yeah.
Also, I talked about the idea of making some kind of formal connection between MHA and PROS as it relates to helping to support the peer specialists that will be working at PROS.
Mm-hmm.
Given the kind of history that MHA has, and that they have people who have long careers in doing peer support work and are certified peer specialists. So I don't know how exactly that would look, or even if it's possible, but it is something to think about. Are there ways for MHA and PROS to collaborate in supporting the peer support work that will be happening at PROS, and even, the other way? I mean, whatever PROS, so some kind of formal or, defined relationship, I think, would be useful. But I'm particularly interested in making sure that there is a way for the all of the peers who identify are either certified or identify or work in positions that are identified as peer support in developing a peer support network for their own benefit, because doing this kind of work is difficult. I mean, it feels like we've been talking about peers in the mental health system forever, but it's actually a fairly, if you look at the entirety of the history of actual formal peer support, it's a fairly new concept, and it's a fairly new idea in outside of larger places like New York City or Buffalo or Long Island, where Ellen Helian ran with other people, ran a peer-based housing program for years, and had actually has had peers in PROS programs. And I'm also particularly interested in trying to develop, if there hasn't already been developed, a member advisory group at PROS. So just some of my thoughts. But I thought it was a really good meeting. I'm particularly impressed that so many people responded to Harmony's invitation, and I'm particularly pleased at where we are in the discussion at this point.
Yeah, it was a very good meeting. I also found the discussion about having peers being part of the treatment team, about kind of the pros and cons of that, was interesting. I mean, that they should be part of the multidisciplinary team, and yet keeping that peer role, and how that's a little tricky.
Mhm. Elise, did you have anything additional to add?
The only thing that we also talked about was, in addition to the idea of having possibility of having peers support people in the ED, that we could possibly, talk about the idea of having peers available for discharge planning at the hospital.
Mhm. Right, thanks. Good. Just as kind of a side note, I found it a really helpful model for us to kind of immerse ourselves in an issue. And I appreciate Harmony's putting together a really thorough meeting where we could learn a lot as board members about this issue before being put in a position of making recommendations. So it's probably something we might want to think about in the future as we grapple with other kinds of issues. How can we get up to speed in a way that's helpful about when we're making decisions like this? So just something to think about. Any questions from others who weren't at the meeting? Harmony, can you mention what next steps would be for PROS or for this group?
Well, I'm not sure where we stand. Frank, this might be more your question on the OTR status, because I think that would be our first step. And I know Ellen said that she would help us with getting a job description. I thought that was really helpful. She also was going to offer some guidance that I think the group also recommended around how do you make sure that this position is treated as full membership, and how do you prepare your team, because it is a new role, and then it would go through the typical hiring process. So as far as the PROS is concerned, that's how that would look. I did talk with Heather a bit about the recommendation around A peer person is a unique role and it's a professional role. And it's good for a person to have some support from other peers. And how could we do that? So I think we have to figure that out a little bit. But I think that was a good recommendation because you really want to value that unique role. And there was a lot of discussion on how people can sort of, I think she used the word co-opted into using clinical language and starting to almost sound like one of the treatment team, like a clinical treatment team member versus the peer role. And it's a unique place to have. So having that additional support of other peers, I think is going to be important. So I think those are the recommendations, I think really give us a good pathway forward, and hearing from, these experts also like Ellen and Daniela, it was really helpful. And then hearing all the broad ways people are using peer services already in the community. From the Community Services Board piece, I think it was interesting to hear all the different ideas, and then what are some ways that we can support peers now like that. I'm not sure. I asked people to send me their ideas. I've had people respond back. I sent a thank you to everybody who participated. And I'd heard back from some of them that they really liked the process. I think there would be a place to create some sort of systematic way for peers to get together across their different agencies. And I imagine that would be an exciting group. And they might want to do some projects together. They could do some trainings together. And how do we bring this profession together, whether you're from an OASIS program or an OMH program or a non-licensed kind of service, you're doing similar work. And how do we create a peer group kind of for peers? I think that would be important. And then looking maybe for some of those funding opportunities and having some conversations around that one model we talked about. Is there a way to help people when they're emergency room? Like imagine sitting all alone in the emergency room and you're really frightened and you don't know what's going to happen next and everything's very medicalized, and having someone walk up to you and say, hi, I'm so-and-so, I've been in the hospital before too, and I know it can be a scary time. How can I help you? There are models like that in other programs in other states. So it might be interesting to continue to figure out how to pursue that. So that probably I'll just be doing some conversations with people and looking for funding opportunities. I don't know if it makes sense for the person who kind of brings all the peers together to be, part of, the DCS role or not. So your feedback on that would be helpful. Maybe there's somebody else that would be better at sort of taking the lead on creating that. But I think there was energy among all the peer providers getting to talk to each other. So it'd be nice to find a way for them to capture that. And we were just skimming the surface, right, of all the different services and things peers are doing. And it's definitely going to grow. I'm hearing, from OMH's perspective, they want to see peers in mental health clinics. They want to see peers, their peers on mobile crisis teams. Peers play a vital role, in many, many ways. And I think that's just going to grow. So trying to capture that energy and help people be more collaborative will be good. But send me your ideas about maybe who you think might be a good to lead that, or, and if it should be, coming from me, that's something I certainly would be happy to pick up and do, because I think it's going to be an important future for our field. There are not enough, master's level therapists and 1 hour individual appointments that we can schedule to meet all the needs of everyone. We need to get better at finding all the talent and using every bit we, have for people, right? The old model of you just you see your therapist once a week, for an hour. People have realized they actually need mental health counseling and support. And the demand is just going to grow. I think as stigma hopefully is reduced over time, and we need to meet a lot of people's needs. And so that means we need a huge workforce, and it's going to have to look diverse to match all the needs of people.
Thank you. Great. Frank, any update on the OTR piece there?
Yeah, so the legislature will be taking up the budget 2 weeks from Tuesday. And all of the OTRs that were proposed are in the proposed budget. So barring something dramatic happening on the last day, they should all be official 2 weeks from tomorrow. The budget doesn't start until January 1st of next year, of course, but it's going to take planning and time to do anything. So, I think the work that's being done and the ideas, moving forward right now, hopefully we can, get off running on January 1 when the money becomes available.
Great. Okay, well, we have come to the point in our agenda where we should go into executive session. Can I have a motion to do that? Jan and Kaki a second then. So do you have to do something, Frank?
Yeah, and the purpose of going into executive session is for personnel matters related to appointments.
Correct.
So give me 1 second.